Choking can be compared to a traffic jam on a highway. Just like a blockage in the throat obstructing the airflow, a traffic jam prevents the free flow of vehicles. Have you or your loved one ever been in this kind of situation before? Do you know what to do when you're in this type of situation? Stick with me, let's find out. Choking occurs when an object becomes lodged in the airway, obstructing the flow of air into the lungs. This blockage can be caused by food, small objects, or even a piece of the body's tissue. Choking can lead to breathing difficulties, coughing, wheezing, and in severe cases, it can be life-threatening if not treated immediately. When a person is choking, they may grab their throats, have a panic expression, and have difficulty speaking or breathing. In some cases, they may produce a high-pitched sound while inhaling, known as stridor. If the airway is completely blocked, the person may become unconscious. Choking is particularly common among young children and elderly individuals who may be more prone to swallowing small objects or have difficulties with chewing and swallowing food properly. It can also occur during medical emergencies such as a stroke when the muscle that controls swallowing may be affected. It's crucial to act quickly and properly to dislodge the object and clear the airway. Here are some steps to follow when someone is choking. 1. Encourage coughing. If the person can cough, encourage them to do so to try and dislodge the objects themselves. 2. Perform back blows. If coughing doesn't work, give the person up to 5 back blows between the shoulder blades with the heel of your hand to dislodge the object. 3. Perform abdominal thrusts, that's Heimlich maneuver. This is a technique that uses abdominal thrusts to dislodge the obstructing object. If back blows are ineffective, perform up to 5 abdominal thrusts. Stand behind the person, wrap your hands around their waist, and make a fist with one hand. Place the fist above the person's belly button and below their rib cage, and grasp your fist with the other hand. Then pull sharply inwards and upwards. 4. Get emergency help. If the person is still choking, call emergency services and continue with back blows and abdominal thrusts until help arrives. Preventing choking is also important, especially in high-risk situations, such as eating. This can include cutting food into small pieces for young children, promoting careful chewing, avoid talking or laughing with a mouth full of food, and supervise meal times. It's essential to keep small objects out of reach of children, as these actions can reduce the risk of choking. For older individuals, it's crucial to eat slowly and watch for signs of difficulty swallowing. Choking is a medical emergency, and if the obstructed airway is not quickly cleared, it can lead to loss of consciousness, brain damage, or even death. Whenever someone is choking, it's essential to call for medical emergency help if the situation isn't resolved quickly. Knowing how to respond to choking and taking preventive measures can help save lives and prevent serious injuries. We've come to the end of today's topic on emergency tips for choking. If you found it helpful and useful, please give me a thumbs up by clicking on the like button. Please subscribe to my channel for free by clicking on the red subscribe button. Turn on the notification bell so you'll be the first to know when I upload new videos. If you have questions or concerns or topics that you want me to talk about, please drop them in the comment section and I will attend to them. I'm still your next door nurse and I'm just a knock away. I love you guys. Bye for now.